Stop assuming that hantavirus is something that only happens to other people, because right now in the spring and summer of 2026, cases are being confirmed in regions across North America, and the people most likely to die from it are adults over the age of 60. I need you to hear that again. The people most likely to die from hantavirus are adults over 60, not because they were reckless, not because they ignored warnings, but because nobody told them what to look for, what to avoid, and what to do this week right now before exposure happens. I'm Dr. James Calloway, and I've spent over 30 years in infectious disease medicine. I've watched patients walk into emergency rooms thinking they had the flu, and within 72 hours they were on ventilators. I've held the hands of families who had no idea their loved one had been exposed to something so dangerous in their own home, their own garage, their own backyard. That stops today. A 2024 surveillance report published by the Centers for Disease Control and Prevention confirmed that hantavirus pulmonary syndrome carries a fatality rate of approximately 38%, and that rate climbs significantly in adults over 60, where immune response is measurably slower and lung tissue is less elastic. The University of New Mexico Health Sciences Center, which tracks hantavirus more closely than almost any institution in the country, found that exposure most commonly happens not in the wilderness, but within 100 feet of a person's own home. That study should have been front-page news. It wasn't. Now I'm going to walk you through a countdown of 6 critical actions that every adult over 60 must take this week. And I want to warn you, the number one item on this list is something that almost nobody is talking about, and it may genuinely surprise you. Stay with me through the entire video, because that final piece could be the difference between life and death for you or someone you love. But before we dive in, I want to ask you something personal, and I want you to answer in the comments below, because I read every single one. How old are you, and when was the last time you cleaned out a shed, a garage, or a basement without wearing any kind of mask? Tell me down below. Your answer might help someone else who reads it. Now let's get into it. 6 things every adult over 60 must do this week. We're going from 6 to 1, least urgent to most critical. Coming in at number 6, and this one seems almost too simple. You must understand exactly what hantavirus is and how it actually travels, because the way most people imagine it is completely wrong, and that misunderstanding is getting people killed. Most people, when they hear hantavirus, picture a dramatic encounter, maybe hiking through a remote forest, coming across a dead rodent, something cinematic. The reality is far more mundane and far more dangerous. Hantavirus is carried primarily by the deer mouse, the white-footed mouse, and several other rodent species that live in very ordinary places inside the walls of your home, in your attic insulation, in the corner of your garage, behind a box of holiday decorations you haven't touched since 2019. The virus is shed in the urine, droppings, and saliva of infected rodents. When those droppings dry out, and this is the part nobody explains properly, the virus particles become aerosolized. Think of it like invisible dust. The moment you sweep a floor, shake out an old blanket, or disturb a dusty corner where a mouse has been, you may be breathing in particles that carry live virus. You don't see it, you don't smell it, you don't feel it in the moment. Now here is why this is especially dangerous after age 60. The mucous membranes lining your respiratory tract, your natural first line of defense, become measurably thinner and less effective with each decade of life. Research from Johns Hopkins medical institutions found that adults over 65 have roughly 40% less mucosal immune activity in their upper respiratory tract compared to adults in their 30s. That means the microscopic defense system that would normally trap and neutralize airborne pathogens is simply less capable of doing its job. The virus gets further in, faster. What you need to do right now is make a mental map of every enclosed, rarely disturbed space within 100 feet of where you sleep. Write it down if you have to. Shed, garage, attic, basement, crawl space, storage unit, cabin, even a car that has been sitting unused. Any of these spaces can harbor mice and the virus they carry. You cannot protect yourself from something you haven't identified. Scientific references for this section are linked in the description below. Number 5, and this one is deceptively important. You must correctly assess your personal exposure risk based on where you live, not just whether you've seen a mouse. One of the most dangerous assumptions adults make is thinking, I haven't seen any mice, so I must be fine. But the deer mouse, the primary carrier of the sin nombre Hantavirus strain responsible for most North American deaths, is extraordinarily secretive. A home can have a significant rodent presence for months before a single mouse is spotted. By that point, contamination of surfaces and air may have already occurred repeatedly. Hantavirus risk is not distributed equally across geography. The highest concentrations of confirmed cases consistently appear in rural and semi-rural areas of the western United States, New Mexico, Colorado, California, Montana, Arizona, but cases have been confirmed in 34 states. Margaret, a 67-year-old retired schoolteacher from Flagstaff, Arizona, came to see me after a concerning set of symptoms she'd been ignoring for 2 weeks. She assumed she was just dealing with seasonal allergies. She lived on a beautiful property with a barn she used for storage. She had never once considered herself at risk because, as she told me, "I'm not an outdoors person." She was lucky. We caught it early. Not everyone is. The CDC's hantavirus surveillance data shows that spring and early summer represent the peak exposure window because rodent populations are expanding after winter and humans are beginning to clean out enclosed spaces they've ignored for months. That means this week right now in May 2026 is statistically one of the highest risk weeks of the entire year for hantavirus exposure in North America. Here is what you need to do. Look up your state or county's current hantavirus risk level through the CDC's official website or your state health department. That link is also in the description. Then, and this is critical, cross-reference that information with your immediate living situation. Rural property, older home construction, any history of rodent sighting, proximity to fields or wooded areas, each of these factors elevates your personal risk meaningfully. Knowledge of your specific risk level determines every subsequent decision you make. Number 4, you must create a decontamination protocol before you enter any at-risk space, and the protocol most people are using is completely wrong. Here is what I see constantly, and it breaks my heart because it is so preventable. Someone decides to clean out their garage. They grab a broom, maybe pull on some garden gloves, and they start sweeping. Or they shake out boxes, or they use a leaf blower to clear out debris. Every single one of those actions is potentially turning dried rodent droppings into a breathable aerosol. A broom is essentially a hantavirus delivery system in a contaminated space. The correct protocol, according to guidance from the CDC and supported by research from the University of Arizona's Infectious Disease Department, begins before you ever set foot in the space. You must first ventilate the area by opening doors and windows and allowing fresh air to circulate for a minimum of 30 minutes, ideally an hour before you enter. This reduces the concentration of any aerosolized particles already present. Then, and this is non-negotiable for adults over 60, you must wear an N95 respirator mask, not a cloth mask, not a standard surgical mask, an N95, which filters at least 95% of airborne particles. Your aging respiratory mucosa cannot compensate for inadequate protection. Think of the N95 as a second immune system for your lungs, one that doesn't weaken with age. You must also wear rubber or latex gloves. You should never sweep dry droppings. Instead, you wet mop or use wet paper towels to dampen and collect contaminated material, which prevents aerosolization entirely. Bag everything in sealed plastic bags. Then disinfect the entire area with a bleach solution. 1.5 cups of household bleach per gallon of water is the concentration that has been shown to effectively neutralize hantavirus on surfaces. Robert, 72, from rural Colorado, had been putting off cleaning his storage shed for 3 years. When he finally did it last fall, he followed this exact protocol because his daughter had sent him a video about it. He's perfectly healthy today. His neighbor, same age, same type of shed, no protocol, spent 8 days in the ICU. Same virus, different outcome. The protocol is everything. Now right here, between number 4 and number 3, I want to pause for just a moment. If this video is giving you information you didn't have before, please do 2 things right now. Hit the like button. It tells the algorithm that this health content matters and gets it in front of other seniors who need it. And if you haven't already subscribed to this channel, please do it now. We put out videos like this every week because your health and your life are worth fighting for. Now let's get to the top 3, and this is where it gets really important. Number 3, you must know the exact symptoms of hantavirus infection and the precise window in which treatment decisions matter, because the difference between a hospital discharge and a death certificate can be as narrow as 12 hours. Hantavirus pulmonary syndrome is insidious in its early presentation. The initial phase, which lasts anywhere from 3 to 7 days after exposure, mimics influenza almost perfectly. Fever, muscle aches, particularly in the large muscle groups of the thighs and back, fatigue, and sometimes headache. There is no rash, there is no obvious respiratory distress yet. This is precisely why so many adults over 60 dismiss it. They assume it's a cold or flu and wait it out at home. Then the second phase hits. Fluid begins to flood the lungs with terrifying speed. Patients who are walking around and making tea in the morning can be in respiratory failure by evening. The lungs fill up with fluid, a condition called pulmonary edema, and the heart strains to compensate. Research from the Hantavirus Special Pathogens branch of the CDC found that the average time from onset of respiratory symptoms to critical deterioration is just 24 to 48 hours in adults over 65. That is not a wide window. After 70, the heart's ability to manage sudden fluid overload is compromised by age-related changes in cardiac elasticity. The technical term is diastolic dysfunction, meaning your heart literally cannot adapt as quickly to the sudden strain. Your lungs, which have lost roughly 30% of their elasticity by age 70 according to pulmonary research from the Mayo Clinic, are more vulnerable to fluid accumulation than younger lungs. This is what you must do. Create what I call a Hantavirus symptom diary right now before you have symptoms. It is simply a note on your phone or a piece of paper on your refrigerator that says, if I develop fever, muscle aches, and fatigue together, and I have been in or near any enclosed space in the past 3 to 5 weeks, I will go to the emergency room immediately and I will say the words possible hantavirus exposure to the triage nurse. Those 5 words change the entire medical response you receive. They trigger a specific diagnostic pathway. Do not wait 48 hours. Do not take ibuprofen and go to bed. Go immediately. Number 2, and I promised you this would surprise you, you must talk to your doctor this week about your specific immune vulnerabilities, and you must share your risk level with every person in your household or care circle. Here is why this surprises people. They assume hantavirus is something you handle alone, you avoid it, you clean safely, you watch your symptoms. But hantavirus infection in adults over 60 is frequently a family emergency that unfolds in slow motion. And the people around you are often the only ones positioned to recognize the warning signs before you can. Here is the science behind why this matters so specifically for aging bodies. After age 65, the immune system undergoes a process researchers call immunosenescence. Think of it as the gradual retirement of your immune army. The T cells that coordinate your body's response to novel pathogens, which hantavirus absolutely is for most immune systems, decline in both number and responsiveness. A 2023 study from Stanford University's Immunology Department found that adults over 70 mount a measurably delayed cytokine response to new viral threats, meaning the chemical alarm signals your body sends to mobilize its defenses arrive late, giving the virus more time to establish itself in lung tissue before your immune system fully engages. This is not a reason for despair. It is a reason for preparation. When you speak with your doctor this week, and I mean this week, not next month, you need to ask 3 specific questions. First, given my age and current health profile, how would hantavirus infection likely present in my body? And are there any medications I currently take that might mask early symptoms? Second, are there any underlying conditions I have, heart disease, COPD, diabetes, compromised kidney function, that would accelerate deterioration if I were exposed? And third, is there a pulmonologist or infectious disease specialist in my area you would recommend I see proactively if I have documented exposure? Share this conversation with a family member, a neighbor, a home health aide, anyone who sees you regularly. Give them a printed list of hantavirus symptoms and tell them that if you develop those symptoms and you resist going to the hospital, they have your permission to call 911 on your behalf. This is not being dramatic. This is loving yourself enough to plan ahead. Eleanor, 78, from Santa Fe, New Mexico, did exactly this after her daughter watched a video about hantavirus risk. 2 months later, Eleanor began feeling what she thought was a bad case of the flu. She told her daughter she was fine and wanted to sleep. Her daughter, who had that list on her refrigerator, looked at her mother's symptoms, asked the right questions, and drove her to the emergency room over Eleanor's protests. Eleanor spent 5 days in the hospital and is home and well today. Her doctor told the family that had she waited another 24 hours, the outcome would almost certainly have been different. And now, number one, the single most powerful thing every adult over 60 must do this week. And I want you to really hear this because it is almost never discussed. You must perform a complete rodent exclusion audit of your home and seal every potential entry point before the next 30 days are over. Everything else we have talked about, the cleaning protocol, the symptom awareness, the doctor conversation, all of it is reactive. This is the only action that is truly preventive at its core, because the safest hantavirus exposure is the one that never happens. And the most common reason adults over 60 are exposed is not that they went somewhere dangerous. It is that a mouse was already living inside their walls, their attic, or their crawl space, and they never knew it. Here is what science tells us about rodent entry. The deer mouse can compress its body to fit through an opening no larger than a dime. A gap around a pipe, a crack in a foundation, a space beneath a door where weather stripping has deteriorated, these are not nuisances. They are potential virus delivery channels. Research from the National Pest Management Association found that nearly 29% of American homeowners over 65 had evidence of rodent activity in their homes that they were completely unaware of. After age 75, there is a documented reduction in sensory acuity, smell, and peripheral vision that makes it genuinely harder to detect signs of rodent presence that a younger person might notice immediately. The faint smell of mouse urine, a tiny smear of grease along a baseboard, the distant sound of movement in a wall, all can go undetected. This is biology, not neglect. What you need to do is either hire a licensed pest control professional to conduct a full exclusion audit, which typically costs between $150 and $400 and is the wisest investment you can make this spring, or do it yourself, systematically using the CDC's rodent-proofing checklist, which is linked in the description below. You are looking for any gap larger than a quarter inch around pipes, utility lines, foundations, doors, and windows. Seal them with steel wool packed tightly and covered with caulk, or use hardware cloth. Regular foam or rubber will not stop a determined mouse. Set snap traps in low traffic areas of your home, beneath sinks, behind appliances, in garages and attic access points, and check them weekly. Do not use glue traps, which keep the mouse alive and stressed, causing it to shed more virus. Do not use poison bait stations alone, as they do not prevent exposure to the carcass. Snap traps properly placed are the most effective and safest option. Thomas, 69, from Bozeman, Montana, is a retired engineer who applied his systematic thinking to a full exclusion audit of his home and detached workshop after attending a community health seminar. He found and sealed 11 separate entry points he had never noticed in 12 years of living there. He found evidence of prior mouse activity behind his workshop's insulation. A year later, his health is perfect and his home is rodent-free. He told me that doing that audit was the most concrete act of self-care he had ever performed. I want to close with something I say to every patient I see who is over 60 and feeling overwhelmed by health information. Your independence, your ability to wake up in your own home and make your own coffee and take a walk if you want to. These things are worth protecting with every ounce of knowledge and preparation available to you. You are not too old to act. You are not too set in your ways to change one habit this week. The science is clear that small, specific actions taken before exposure occurs save lives, not after. Before, hantavirus is spreading right now. The risk is real, but so is your ability to protect yourself, and you have just spent this time learning exactly how that matters. You matter. If you found this video valuable, please subscribe to this channel right now and hit the bell so you never miss a critical health update. And I want to hear from you in the comments. Have you ever cleaned out a space without proper protection and not thought twice about it? Tell me about it below. I read every comment, and your story might be exactly what another adult over 60 needs to hear today to take action. Stay safe, stay informed, and I'll see you in the next video.